Hello students, my name is Dr. Chandresh. I am currently working as senior demonstrator in Department of Anatomy, Government Medical College, Bhilwara, and today I'll be taking a demonstration on large intestine and small intestine. So before commencing the demonstration, I would like to extend my warm wishes to you and your family members in these grim situations. And for those who have suffered any losses or are going through any tragedies, I pray to God that you bounce back from those tragedies very strongly. So without further ado, let's begin with our demonstration. So we'll be going through this demonstration under various headings, namely purpose, a slight overview of small intestine, a slight overview of large intestine, the difference between small and large intestine, and how to differentiate between soft organs on the basis of the differences that we have learned. Then the difference between duodenum, jejunum and ileum, and then again how to differentiate between jejunum and ileum on the basis of these differences. Let's start with the aim of this demonstration. So the aim of any demonstration for say is to extract knowledge from books like this, and to acquaint you with that knowledge so that you can understand and identify the gross anatomical structure. When faced the examiner, you can answer some of the basic questions that one should know in his or her first year of Mbbs. So let's start. So this is how the large intestine and small intestine look while in the cadaver. This part is the large intestine and this part is the small intestine. I'll give you a slight overview of small intestine so that when we see the soft part, it would be easy for us to identify it. Okay, so the small intestine starts from the pylorus and ends into the ileocecal junction. As we all know, it consists of three parts: duodenum, jejunum and ileum. Duodenum is retroperitoneal. So anything which is retroperitoneal is fixed. Rest of the small intestine is highly mobile. Jejunum constitutes 2/5 of the small intestine and ileum constitutes 3/5 of the small intestine. Now, the small intestine is of 6 meters of length and it consists of various circular mucosal folds, villi, lymphatic follicles and pure patches. The locations are different at different places, but most important is what is the main function of small intestine. The main function of the small intestine is to absorb and digest maximum amount of food that a human ingests. Now, that is the reason that it has such a vast length, and also it has villi and microvilli. Along with that, circular mucosal fold also helps in increasing the surface area and hence helps in increasing the digestion and absorption of the food. Now we'll come back to small intestine and try to learn the difference between jejunum and ileum when we'll see the soft part of small intestine. Another important part of gut is large intestine. The large intestine starts from the ileocecal junction, ends at the rectum or the anal canal. Now, the large intestine is divided into several parts, namely appendix, cecum, ascending colon, right flexure of colon, also known as hepatic flexure because it is situated near the liver, transverse colon, then left flexure or left colonic flexure or the splenic flexure. As the name suggests, the flexure is situated near the spleen. Then the descending colon, which terminates into sigmoid colon and ends into rectum and anal canal. Now there are various peculiar features of large intestine which helps us to identify large intestine in a soft part. So the large intestine is 1.5 meter long. The main purpose of large intestine is to store maximum amount of food that comes from the small intestine and to absorb maximum amount of solutes and water from that food. The large intestine also has a very large caliber as compared to small intestine. It has numerous goblet cells so that the matter coming from the small intestine can be easily passed. Also, it has various solitary lymphatic follicles. The large intestine, just like any other layer of the gut. Also, the most of the parts of large intestine are fixed, except from the transverse colon, vermiform appendix, and the sigmoid colon. Unlike longitudinal muscle coat, which is present throughout the gut, in large intestine it is present in the form of thin bands, which again forms a very important identifying structure of large intestine. So the longitudinal muscle coat is present in the form of a thin band across the large intestine, which is called tinea. So in ascending colon, cecum, sigmoid colon and descending colon, it is present anteriorly, posteromedially and posterolaterally. Anteriorly, it can be called as tinea libera. Posteromedially, it can be called as tinea mesocollis, and posterolaterally, it is called as tinea ommentalis. But on the transverse colon, the position of tinea are anterior, superior and posterior. Another important feature of identifying large intestine and differentiating it from the small intestine is the presence of epiploic appendages, which are present more in number at the sigmoid colon, which I'll be showing you later on when I'll show you the soft part. Epiploic appendages are nothing but the peritoneal folds present on the surface of the large intestine, which are filled with fats. Another feature of large intestine is the presence of circulation. Circulation are formed because of the uneven distribution of longitudinal muscle coat and circular muscle coat, which forms a circulation. We differentiate and we know the differences between the large intestine and small intestine. Now, there are various differences between large intestine and small intestine, which are given in theory. But today I'll be telling you only those differences. Although you have to remember all the differences, but I'll be telling you those differences which help us to identify the small intestine and the large intestine. First, the very basic difference is that the large intestine is shorter than the small intestine, but sometimes it's become very difficult to differentiate or to identify the large intestine and small intestine on the basis of their length. So we'll have to move further for the other differences, like the large intestine has vermiform appendix to it, but sometimes there is no vermiform appendix as well. So what we can do? What we can do is we can go through the mesentery of the small intestine and large intestine. The mesentery, when it starts from the jejunum, it is thin. There is less fat into it. But as it proceeds towards the ileum and towards the large intestine, the content of the fat increases. Another important feature is the presence of tinea. So when we will see the soft part, I'll tell you how to identify the tinea. Then another thing is to find the circulation. Circulation are prominent in large intestine, but they are not so visible in small intestine. Also, in small intestine you can see circular folds, but that is not the case in large intestine. And then there are other differentiating features, but those are not helpful in identifying the soft parts. Then, once we identify small intestine and large intestine, then examiner may ask how will you differentiate between jejunum and ileum. Again, as I told you that there are various differences, but we need to know those differences which will help us to differentiate between the between the jejunum and ileum, and to identify the jejunum and ileum. So to identify jejunum and ileum, we have to first go towards its mesentery. The mesentery of jejunum has less fat, so it's transparent. But on the contrary, the mesentery of ileum has more fat, so it's not that much transparent. The vasa recta or the blood supply, it's long. Okay, so it form a window. There is a huge gap. There is a huge window, usually formed by one or two vasa recta. But that is not the case with ileum. The vasa recta is short and there are no windows. Then the walls of the jejunum and ileum. The walls of the jejunum is thicker as compared to ileum. Then the circular folds. The circular folds are more in jejunum as compared to ileum. Then there are other theoretical differences, but are not important when it comes to identifying the gross structure. But they are important when you have to write in the examination. So you have to learn all the differences, but keep in mind especially those which will help you to know and identify the soft part.
So till now what we have studied in the demonstration we'll apply in the practical, and that is the most important thing. That after listening to the demonstration you can go and identify the soft part. So here we have two intestines. Now the first question of the examiner might be that how you will differentiate that which one of these is the small intestine and large intestine. So as you'll recall from the demonstration, I told you there are specific peculiar features regarding the both intestine. Okay, one of them was the length. The length of the small intestine is more than the large intestine. But over here, it's again very difficult to identify which one is larger or not. So we'll not identify the structure on the basis of the length, because while taking out the intestine, small intestine, the duodenum, which is retroperitoneal, gets sometimes it's not taken out, so the length may vary. They are very subtle and very easy differences which will help you to identify the structure. Okay, so first of all we'll see if there is there any vermiform appendix seen in both of these. There are no vermiform appendix as well. So we'll see that in this intestine there are certain circulation. I told you circulation happened because of the longitudinal muscles. Okay, so you can see that there are circulation. This is one circulation, this is one circulation, this is one circulation. So this could be the large intestine. Again, there are also epiploic appendages, okay, which are seen in the large intestine, and they are the most salient features. So here you can see that these are the epiploic appendages. Okay, so this is confirmed that this is the large intestine and this is the small intestine. Okay, now what are other features of large intestine that we can see in it? Apart from the circulation and the epiploic appendages, we can also see the tinea. This is the tinea, the longitudinal thin band of the longitudinal muscle band in the large intestine which is present. Okay, so we have seen the three features. This is the mesentery of the large intestine. Now in small intestine, we'll again see some peculiar features. I told you that in small intestine, the jejunum has prominent circular mucosal fold which are needed for absorption and digestion. So we can see that there are various circular fold. Okay, starting from here. here. And gradually the circular fold decreases as we move towards the jejunum. Okay, but you shouldn't always identify the jejunum and ileum on the base of circular fold. The important thing is seeing the mesentery. Now here, due to the limitation, I can't show you the translucency between the mesentery so that we can see the vasa recta, but still the mesentery of the jejunum is thin than the mesentery of the ileum. So we can see long vasa recta in jejunum, okay, which will form windows when you will see through a light. But this doesn't happen in ileum. In ileum, the mesentery is thick, and when you see through the light, they are small and fewer vasa recta with various arcades. Okay, that's how. So these are the most important distinguished features that one should know while examining the gross anatomy of large intestine and small intestine. These both are very huge topic. I have told you important features which one should know when he or she faces the examiner, because these are the things that helps you to differentiate between the organs. If you'll do a blunder in the examination, choosing the wrong soft organ as large intestine, small intestine, it will be very bad for you. Subsequent lectures will tell you a detailed stuff about large and small intestine.
That was all about today's demonstration. I hope that you understood it. This is my first stint at making videos, so if you want some changes and if you think that something can be improved, you are free to advise in the comment section. And if you have any queries or questions, then also you can ask them in the comment section. I love to answer them. My next demonstration will be on pubis. Till then, goodbye. Be safe.